this is Dave from Heads Up Health. If you caught our last podcast on Data Driven Health Radio, we interviewed Dr. Philip Blair, who is with a company called Elixinol that is making high-grade, 100% pure CBD oils. And Dr. Blair talks about the body's own internal endocannabinoid system, which means we have the receptors for these cannabis molecules inside of our body, and how powerful these external supplements can be at stimulating everything from the immune system to the thyroid to our own neurotransmitters, and can help with things like chronic inflammation, sleep issues, cancer treatment, and a wide range of other conditions. I won't do it justice, so if you want to learn more about CBD oil from the expert, check out our podcast.
Hi, everyone, and welcome back to Data Driven Health Radio, where we are looking at the science, the stories, and the technology that is enabling people to take a much more data-driven approach to managing their health. And with me today, I'm very honored to have Mr. Philip Blair. Really looking forward to our discussion. Welcome, and maybe you can just give us a quick intro in your own words as well.
Well, David, thank you very much for having me. Love to talk to you about these subjects. They're so important in my life, and I really want to make a difference in everybody else's life using these particular techniques and methods and changing the course of the medical trajectory that we have.
And I think all of this is leading up to the conversation I'm most interested in, which is the work around cannabidiols. I've had family members who have had incredible experiences using these products personally. One family member in particular who had kidney disease and was able to use different interventions around cannabidiol, specifically medical marijuana, which is obviously separate, but in the same thread. So I'd love to segue into that, and we have a number of our listeners who have submitted questions that I'd love to get to at the end. But first and foremost, I think let's just level set on the difference between CBD and THC, because they're very different. One is a psychoactive, and one of them, there is no psychoactive component to the CBD. So let's just dispel that first and foremost so that people don't think that this is going to be a psychoactive experience. So just break down the difference for us first between those two, and then we'll build from there.
Yeah, let's put it into simple categories. Basically, you've got two plants.
Yes.
You've got marijuana,
Yep.
and you've got industrial hemp. They're both
Yes.
cannabis, but they're completely different characters. The
Correct.
marijuana is that short little squatty
Yep.
plant. They're going after the buds. Well, the industrial hemp is a tall, lanky that's used for fiber. It doesn't contain any significant amounts of psychoactive substance.
Yep.
Now, marijuana contains THC in significant amounts. Sometimes it's up much as 25% or even higher. But the industrial hemp has very, very low amounts. And usually those fields and those plants are tested to see what they're containing. So in among the cannabinoids, and so if you're talking about these particular molecules, which are about 22 carbons, reason I bring that up is that's very similar to omega-3 fats, is that there are 22 carbons. And I'll get to the connection with that later on. But these small molecules, and if they're in a certain structure, they represent cannabinoids. And these are signaling molecules. It's not a matter of they're being metabolized. They're signaling molecules, and they signal and they have an impact on the body in different areas.
Yep.
Now, you know, THC causes a high. That causes a certain amount of impairment.
Yep.
It does cause provide some analgesia, but it also, and it's some anti-cancer effects. But there's a lot of impairment, and there's a lot of hunger. So it's stimulating a number of different aspects, not only the neurotransmitters, and the immunologic, but it's also doing the hormones, in particular the gut.
Yep.
If you move away from the substances with THC and you're looking at industrial hemp side, the industrial hemp side doesn't have any significant THC, and so you're getting mostly is going to be cannabidiol. Now, there are other cannabinoids, but for this discussion, let's just stay on the topic of THC and CBD, and I'm going to focus entirely on CBD, because what I've seen is that the medical benefits, and we talk about medical marijuana, which is really a blend of THC and CBD.
Yes.
I've seen almost all of the medical benefits be available in cannabidiol alone, so that THC is not required. Now, it does offer some benefits in special cases,
Yes.
not at high levels, but at very low levels, and that will amplify and enhance the effectiveness of the CBD, but it's not required. That's a misunderstanding that a lot of people read into it, and it's a little bit of a fiction that is promulgated by the marijuana industry.
I think that's really important to clarify just for everybody, that there are no, what we're talking about here is CBD oil. I think a lot of people may associate that with marijuana, which is not the case. We're talking about the non-psychoactive component. People may have had experiences with products that are blends, because they do sell blends in different ratios of THC to CBD. That's also not what we're talking about here. So what we're going to talk about for this discussion is exclusively the CBD-based component. I took a quote that you made on the website for your company, saying that cannabidiol is the most profound and exciting health promoting substance I have ever witnessed or experienced, which presumably is why you've gotten involved in working with this firm out of the Denver, Colorado area that's bringing this product to market. And because it's 100% CBD based, you can ship it anywhere in the world. This is not a regulated product at all. So we'll be specifically speaking in those terms. And I just want to clarify for everyone that that's the product we're talking about. None of the blends, just specifically the CBD oils. So for those who have tried it, had a product that gave them a psychoactive experience, we're not talking about that. This is a very specific discussion.
Let me just say that about the jurisdiction and the legal aspects of it, there's a lot of debate about it.
Sure.
A lot of concern. If you really want to read about some more detail and have an understanding of going back and forth, then you might look at Wikipedia. They've done a pretty good discussion about cannabidiol. The federal government, what they say, and what the states are saying, and what the science says, putting those all together is a bit of confusing, and you'll get different opinions from different people. Fact is that Elixinol is a global company,
yes,
and it's providing cannabidiol in 23 different countries and every state in the union, and it's available by internet ordering anywhere.
Yes.
And personally, I talk to people in Japan, in Slovenia, in the UK, South Africa, Australia, New Zealand, Korea.
Yep.
You know, I've got a dialogue with thousands of people in all different areas, and they're all using cannabidiol, and just a wonderful effectiveness for many of the different things. But the legal aspect is really a touchy area. I've never seen anybody incarcerated or any legal problems because of it specifically, but there is that risk and concern.
Yep. But on your company's website, the product can be ordered by anyone within the United States, and in addition to 23 other countries.
Exactly.
So let's set the record straight on that. Now, if you could, Dr. Blair, educate us on CBD. And some of the information I found fascinating was the phytonutrients that are involved in CBD, which can be incredibly healing, and getting it in its natural package also is the way nature intended it to be, all packaged up, versus distilling these things out. So if you could, for those who are not familiar, educate us on some of those phytonutrient and other health benefits that are part of the CBD plant, because when I was reading it on your website, it was incredible. The antioxidant benefits, there are signaling benefits. This is an incredibly powerful compound. So could you share a little bit more on that?
Yeah, be glad to. Now, when you take the cannabis plant and you extract the juices of that, you really are looking for a product that is a full spectrum, that has
Yes.
a little bit of the other cannabinoids that need to be there, and some of the polyphenols and some of the other substances that are naturally occurring. They produce what is called an entourage effect. They really balance out, they round out the cannabidiol so that it is more effective, and it works within the body in a more effective way. Now, you can take, and there are products that are being made with just pure isolate of cannabidiol,
Yes.
and it doesn't have any of the other molecules on. I haven't seen the performance of those particular pure molecules performing as well as the full spectrum products.
Yep.
I think that's why you should look at a full spectrum rather than an isolate.
Yep. And cannabinoids in general have very specific healing properties. And so perhaps you can just explain a little bit about more about what they are, and just get into some of the mechanisms around how these can be so powerful. I also found it interesting that on your website that every culture going back into human history has identified these as a plant with incredible healing properties. So just how do these compounds in there work, and share a little bit more for those of us who are new to how this stuff works.
Well, I think the most important to understand is that within our bodies, we have our own cannabinoid system.
Yes.
It's called, just like the endocrine system, endo
Yes.
meaning inside, and
Mm-hmm.
crine meaning having to do with hormones. So we have our own endocrine system. We also have our own endocannabinoids.
Yes.
We make our own THC-like molecule
Yep.
right inside our nerve cells and right within some of the molecules and that are macrophages and immune cells. And so we've got an entire system that is sensitized for our own cannabinoids. But this plant has found a way to provide the phytocannabinoids, the one
Yes.
from the plant, to be able to deliver the body and signal to make changes. You know, what over the last 4 years, I've realized that the endocannabinoid system, our endogenous system, is a mediator. It's like a translator for what's going on outside of the world and bringing it in, as well as what's going on inside, like in behavior, psychology, experiences, emotion, and putting that out, changes on our physical body as a result
Yes.
of that. So
Yep.
it's really acting in an intermediary way. Now, the main functions that I see with the cannabinoids within the body amount to the neurotransmitter area. The synapses between the nerves are very sensitive, and the cannabinoids actually modulate in that particular gap
Yep.
between the nerve transmission. So
Yep.
neurotransmitters, key and important. Number two is immunologically.
Yep.
We've got an immunologic system, and we're constantly exposed to immunologic threats in different areas. And right now, the common disease problem that we're encountering is an overactive immune system. So there's
Yes.
development of autoimmune diseases where we start to attack our bodies
Yep.
for whatever region, and that also represents in a great deal of allergies that manifest. So how can that be controlled? And so cannabinoids might be a way to control a lot of that hyperimmune reaction that's going on.
Yep.
And then third area, and it's not the least and it's not the only, has to do with hormones.
Yep.
The modulation of the adrenal hormones, of the thyroid hormones, of the pituitary hormones, of the sex hormones.
Yep.
These are all under the modulation of the endocannabinoid system. Now,
Yep.
we didn't really know much about this, but the breast produces a magnificent cannabinoid. An anandamide is the name of the common word for the stimulating substance. And that cannabinoid is actually what stimulates the child to suckle. If you've ever watched a nursing child, you've seen them go to the nipple, and they get really excited when they get milk close to the nipple and they smell the milk. But when they latch onto the nipple, anybody watching a child will be taken by a number of gulps of that breast, and then they'll roll their eyes back and smile and go into
Yes.
a very relaxed state. That's cannabinoids.
Yes.
That's what's doing that.
Okay.
And the same thing is involved in the setting up of the uterus in preparation for the egg implantation. And the first cannabinoid receptors are actually on the morula. The early fertilized egg actually has cannabinoid receptors that are active. And it's very, very important that we have a balanced cannabinoid system in that process. Now, that leads to a problem that we're seeing more and more of, is a clinical endocannabinoid deficiency phenomenon.
Yes.
And we're seeing more and more of these diseases match up and correlate with imbalances in the endocannabinoid system. So a lot of the mystery diseases that we have there may in fact be related to dysfunctions in the endocannabinoid system. And that's where these phytocannabinoids come in. They can serve as signaling molecules and to return balance to the body and restore that unbalanced system.
Yes. So in many senses, it's a deficiency in the body's own levels of these compounds. And I think it's just incredible what you said there. For those, let's just repeat it here. The body has its own internal and endocannabinoid system, which is in the body already. We're born with it. And it has signaling implications for everything from the neurotransmitters in our brain to the immune system to the hormonal system. Adrenal and thyroid are both epidemic conditions out there already. Hyper and hypothyroid, adrenal dysregulated issues due to stress, due to environmental toxins, due to all kinds of different things. So this endogenous system that we have has signaling implications in all of those areas. And you're seeing a deficiency in the, whatever you want to call it, the food system, the health system. We're not getting enough of those compounds naturally into our bodies. And that's the potential for a lot of the CBD-based products to come in, exogenously take them, and then start to balance out and regulate some of these internal signaling systems inside of the body. Am I feeding that back correctly?
You are, but you're putting it too narrow. You're putting it on the food, and it's much broader than food. It's experiences.
Yes.
For instance, in PTSD, childhood abuse actually leads to the potential for PTSD. In fact, that's probably the most predisposing factor, whether it's child abuse or abuse, neglect. All of those things lead to a shifting and a dysfunction of the endocannabinoid system.
Experiences, life experiences.
Yes.
Wow.
So that's what I was talking about, this translation,
yes.
that these events that are occurring outside are being translated into the body in terms of physical illness through the endocannabinoid system. Fantastic. We didn't know how it worked, but now we're seeing this evidence of the sensitivity that the body has to these environmental things. And that goes along with the microbiome. The microbiome is also signaling in similar way. Just as the microbiome produces some of the beta-hydroxybutyrate that is stimulating and balancing and restoring for the brain, the same thing has happened with the endocannabinoid system, that there's signaling that goes on with the bacteria and it's using some of the endocannabinoid system. In fact, one of the highest populations of cannabinoids, endocannabinoids, is located in the gut. Mm-hmm. I didn't say that as a separate issue, but the gut has a massive amounts of neurotransmitters, and so therefore it's going to be quite a bit involved with the endocannabinoid as a regulatory measure for those neurotransmitters.
So let's take this forward then to some of the applications, specific applications. Most of our users are working on one or more chronic diseases, and I'd love to just talk a little bit about how these products can be implemented. I've got a list of them here, but maybe we could start with migraines, for example, and then just run down the list. I've got migraines. We have diabetes, cancer, especially, and then just kind of go from there. But how are these making their way into the treatment of these specific conditions? And when might you want to start employing them?
It turns out that patients are finding them. They're failing at usual therapies, and they're being introduced, and they're looking for something more. Typically, I'm fairly transparent, so people are able to find me and ask me for consultation to find out if CBD is going to be effective for their condition, especially when they haven't been successful with the standard medications. And it's essentially the frustration that patients feel that gone so far and they haven't been benefiting from conventional therapy. Then they're ready to flip over to do something alternatively and to incorporate the possibility and do some experimentation, N=1, for themselves with the cannabidiol in particular.
So let's get into a few specific examples. I know diabetes is one, which is ultimately.
Well, we're going to go back to migraine because you brought that up first.
Sure.
And migraine is particularly valuable. Now, using cannabis for migraine was actually the primary therapy in the mid-1800s, and it was in standard medical journals as well as available as a substance from the pharmacy. It was actually prepared and it was in the pharmacies the standard way. And cannabidiol is just as effective for migraine headaches. And I've been able to have people stop and prevent migraines as well as treat migraines using the cannabidiol. The dosage is, first of all, migraine, we're not sure, it's still not well defined exactly what is a migraine or what causes a migraine, where the problem is. But
a lot of people are trying to figure that out, and they're doing trial and error, and they're doing their own N=1 experiments. Is it food sensitivity? Is it something related to all kinds of external factors? So yeah, we have a lot of people trying N=1. I'm sure a lot of them would love to try this intervention as an N=1 as well.
Yeah, and I've had great results using cannabidiol in a modest dose as a maintenance, and then when the acute headaches, using increasing to as much as necessary. Now, the general dosage guidelines with cannabidiol is that, number one, it doesn't have any toxicity and it doesn't have any significant adverse effects. And so the real guideline is use as much as needed in order to control your symptoms and then readjust it. It doesn't matter whether it's twice a day or 3 times a day or 4 times a day. Adjust it to your particular need. Now, you need to get a good product, though. There's so many products that are out there on the market. You can't be sure what's in them and how effective they are. That's why I've gone with Elixinol, because I know what the product is. I can see full analysis, and I know what the balance is in those molecules and the dosage range for those particular problems, whether it's migraines or diabetes or cancer. I can get people started and then help make adjustments as they go along.
So let's jump to cancer then. I have people in my own friends and family who are working with health practitioners. In these cases, they've already been diagnosed, and they're working with a integrative oncologist who is including this as part of the regimen. In other cases, I'm really curious about your thoughts on using them as a preventative mechanism for cancer. So both from a prevention and from a treatment point of view, can you share how these products are used in the realm of cancer?
Yes. So cannabidiol has actually get some extraordinary evidence in preclinical studies. We don't have any human studies. There's a lot of complications for doing human studies, and we're not right at that level yet. We don't have those, and that takes decades in order to produce that. But the preclinical evidence is really superb. Almost all cancer types respond to cannabidiol in terms of their cannabidiol having this feature that it induces cell death in cancer cells. But not only cancer cells, any abnormal cell, it will induce a death to it. It's self-death. It doesn't kill it. It signals the cell to die. And in that process, it self-destructs.
Autophagy, is it the same as autophagy, for example, when you're fasting, or is it different from that?
It's similar to that, but actually that autophagy is actually the breakdown of the materials of the cell, but what the cell death is that is slightly different in that. And the cannabidiol is inducing a cell death. Now, at the same time it's inducing cell death in the abnormal cells, it's supporting and protecting normal cells. So you can immediately see it in the case where you might get chemotherapy. It's going to protect the normal tissues, which is so often damaged by the chemo and radiation, while killing and facilitating and enhancing the killing effect of chemo and radiation on those cells, as well as it's having its own properties. Now, for the cancer effects, cannabidiol has been shown magnificently to have that effect of killing the cancer cells, but also preventing metastasis and preventing extension of the cells. So as they spread out, they can't spread out. It blocks that spreading. And it prevents the formation of the vasculature that will be associated with it. And it stops the inflammation that is surrounding the cells. In addition, it continues to paralyze the cancer cells at the mitochondrial level, so they cannot function properly. And that's another reason why they induce apoptosis, the killing, the self-killing that goes on with it.
So it sounds like those things are very similar to the reasons people are using ketogenic diets for cancer. The same types of reasons, starving the cell and preventing growth of the cancer cells while not inhibiting the growth of the healthy cells, using a ketogenic diet as an adjunct to chemotherapy to help lessen the toxicity. So when I was hearing you state those benefits, that's all the reasons people come to me and tell me they're using a keto diet for cancer. And it sounds like the cannabidiols are doing the same thing. So it almost seems like you could get a 1-2 punch if you combine
Yes,
low carb keto with
exactly right.
like another exponential way. And even if you are using it with a conventional chemo, it sounds like these are very complementary and perhaps far more powerful together than either one of them on their own.
Ketones specifically act at certain receptors in the nucleus. It's called the PPAR receptors.
Mm-hmm.
And they're signaling that receptor to produce a cascade of anti-inflammatory cytokines
Yep.
and reflexes and enzymes. It's also signaling the mitochondria to change their metabolic slant towards fat metabolism and away from carbohydrate metabolism.
Yep.
And that's the same thing. Cannabidiol does the same thing, but cannabidiol goes much further. It's just that you, as you mentioned, starving the cancer cell, not allowing any carbohydrates for the cancer cells to bypass and get around and defend themselves. And really with the ketogenic diet being really focused on both the nucleus and on the mitochondria, and denying substrate for them for metabolism and growth. On the cannabidiol side, you also have that anti-metastasis feature and the anti-blood vessel feature that goes into it.
So let's shift a little bit to prevention, because we talked about treatment, and a lot of the prominent speakers in the ketogenic world.
Well, just before, I don't want to go too fast on the cancer.
Got it. Please, yes, close out there.
There is some specific protocols that I found very, very successful, the Elixinol product. And I can highly recommend. I've got a number of patients who've gone into remission from stage 4 disease.
Yep.
This is certainly no guarantee, and I'm not going to suggest that. But using cannabidiol, you actually get a number of other benefits that come in, and I often overlook the benefits. The anti-nausea effect, it comes with the cannabidiol. Improvement in mood and general well-being. The analgesic effect. So often patients with cancer are sick and they're in pain, and the cannabidiol will help correct that, as well as treat depression and mood disturbances, and protect their normal tissue from that chemo and radiation. So cannabidiol offers a host of other benefits and protections in the treatment of cancer, and is great in combination with a ketogenic diet. But unfortunately, so many patients are not willing to go the ketogenic approach for situations. So combining those would be an ideal situation. And I tell people about the ketogenic diet, but I have very few takers who are really willing to go there.
Understood.
In terms of dosing for cannabidiol, using a full spectrum product, I found that 90 milligrams is an effective dose.
Yep.
You don't have to do 2,000 milligrams. Not in my experience with the remissions I had. It's on the order of 90 milligrams. And there are a few other things that we need to talk about, and that is omega-3s. Cannabidiol does not work in omega-3 deficiency. And the reason why is that omega-3s are precursor molecules to the endocannabinoid system.
Okay.
And cannabidiol won't work in it. You've got to have the omega-3s because they represent a major portion of the receptors on the cells and the signaling molecules that the body uses in the endocannabinoid system for telling the body what to do, and action-oriented within the cellular systems.
Yet another reason to be making sure that you're properly getting enough omega-3 either from diet or from supplementation. So that sounds like it's an important part of the puzzle here as well. Are you seeing, Dr. Blair, any of the conventional treatment facilities starting to adopt this alongside the conventional treatments, or is this still not something that is acknowledged, recognized from traditional chemotherapy-based approaches?
I don't see anybody using this particular approach. They're very reluctant in light of some of the controversy that goes on.
Understood. Okay.
So, but in terms of prevention of cancer, I mean, this is really quite valuable. Yes, it has, because of the benefits of cannabidiol in general, low doses of cannabidiol could prevent cancer very effectively and prevent recurrence of cancer after somebody has already had it. The patients that I have in remission are perfect examples.
Well, if you listen to experts like Dr. Thomas Seyfried, Dom D'Agostino, they often will state that as a preventative technique, an extended fast done once or twice per year, where you're pushing your glucose ketone index below 2 for example, is an effective cancer prevention strategy. And just being on a low-carb diet in general can be a preventative strategy. There are cancer causes coming at us from all angles in our society: toxicity, exposure to chemicals, excessive sugar consumption. So there's all of these forces coming at us. What are our defenses? It is using a low-carb diet, potentially doing extended fasts throughout the year, perhaps twice a year, where you do a 3-day fast or longer. But I'm also very interested in this as cannabidiols as an add-on therapy, where this is just something. I mean, I've got a handful of supplements on my desk I take every day. And would this be something that could be safely added on a daily basis as part of a prevention strategy, just like you'd take an omega-3 fish oil? Is that a good way to think about it?
I think that is a very good approach. It has preventive qualities, but it also provides in performance enhancement. So what I see using cannabidiol is a number of particular benefits that are wonderful features, and it's sort of ideal for a supplement. Things like improved mental focus and clarity, clearing the fog, a relaxation and a calmness so that you're better able to deal with situations. The concept that you want to take care of stuff and get things done, a motivational and an action-oriented, so you're really, truly activate. There's also an improvement of your vision. So you're actually seeing better, greater distance at greater refinement. And I have to warn people that they may have to get new glasses when they use cannabidiol because their vision will improve.
And what would be a maintenance dose? You mentioned 90 milligrams on the cancer side. What about just day-to-day general health, prevention, and wellness? Where would you start?
15 milligrams per day seems to be about a really good maintenance dose. I recommend twice a day, so 15 milligrams twice a day. Because one of the other benefits we didn't get to was sleep. People have generally improved sleep quality with it, and it's very subtle. So. And with regard to performance, you have greater tolerance of anaerobic activity, and you're going to have faster repair of any type of injuries. It's anti-inflammatory in a superb way. So if you're going to strain or pull a muscle or cause some soreness, cannabidiol is going to control that. So you've got very fast recovery after vigorous exercise. And your reflexes are about cut in half in terms of the speed with which you can react. Imagine a ball player of any sort being in any type of competition. Improved reflexes will give them the edge in whatever sport that they're in.
Well, that's a wonderful segue to some of the questions we got from our users. And you touched on one that's incredibly intriguing. We have a lot of users now who are using very, very accurate devices that measure sleep quality, and not just total quantity. They report on the amount of time spent in each of the sleep stages: deep, REM, light, total, etc. And there's a lot of Heads Up Health users that are looking to, they're seeing perhaps very low deep sleep or low REM sleep or poor sleep quality in general. And so one of the questions was specifically related to the sleep stages, if you have information there.
Oh yeah, I've got specific information. Cannabidiol has been shown to be effective at reducing the amount of REM type of anxiety related sleep. And it reduces that particular area, and it leads to greater stage 4 sleep.
Deep sleep? Stage 4 being deep.
Deep sleep, yes.
So a reduction in anxiety REM, higher deep sleep. That's what a lot of the people who are using the Oura Ring, I have it here, and other sleep tracking devices, the average person now is able to start quantifying these benefits. And I spoke with one of the doctors on our advisory board who has reproduced these results himself. So yeah, very fascinating how this applies to people with good sleep who want to get better sleep. And then what about people who have insomnia? I had one of the questions. So that first question was from one of our individuals, Chuck, who is, he's with a company called Oura. Yeah, so just a little more on how it improves the sleep stages, and then maybe we can segue to insomnia as the next part of the discussion.
Well, cannabidiol doesn't put you to sleep. It's actually been used as a waking molecule. It helps you wake up, be alert, be able to get things done. That's great. But at the same time, in giving that calmness and that relaxation, that really facilitates sleep and a better quality of sleep and a deeper sleep.
Yep.
In that process. Yeah. So when people use cannabidiol, it's that side benefit. Using it during the day, they improve their sleep. Mm-hmm. And universally, people will tell me, well, gee, yeah, I did sleep better. I slept better than I usually sleep. Now, it's not anything dramatic, and it doesn't knock you out. It just gives you a normal, deeper sleep, higher quality. But don't take it right before bedtime, because it can activate you. It activates your brain, and you can get really kind of cranked up thinking about things, and that will prevent you from going to sleep.
So how far before sleep would you recommend?
1 to 2 hours before sleep, before sleep time.
Yep.
It's a lot of variable, because some people do take it in the night. If they wake up, they'll use the CBD, and they'll be able to go to sleep right afterwards. You got to experiment. It's very customized to the individual in use. And that's the same thing for the doses. If you're going to use cannabidiol, you want to find out if it's working, and you want to find the dose that's effective for you. And sometimes whatever's written on the bottle, it may not be the one that works for you, because everybody's cannabinoid system is different. So
of course,
you've got to find the dose that is effective for the symptom
and
that
dose and the product. I would imagine.
You should do that quickly. Don't wait around for weeks. I talked to a woman this morning who had been on a product for 3 months and hadn't seen any benefit from it. But for 3 months. And whereas I talked to her, and I like to talk people through their first dose, because when she didn't respond to the first dose, I said, double it right now, double it, and hold it in your mouth and use it and hold it for 3 minutes. And then let's see the effects. And then I could see the changes. She changed her voice, the speed of her language, her enthusiasm, and she started laughing at me. And it was an appropriate laughter. It was a humor. It's a lightening of the mood, an improvement and relaxation, so that people will laugh. And it's that normal improved sociability that occurs, a bit of a humor and a smile. Another gentleman I saw today was PTSD.
Yep.
And he was the first time using. I had him take a few of the liposomes. And Elixinol has a product called liposomes, which is a small micro-sized CBD that is wrapped with a phosphate shell that makes it water soluble.
Yep.
So
familiar with
water.
Yep.
And it has greater potency, greater bioavailability. And so that 1 milligram of the liposomes is about 5 milligrams of the tincture. In his case, he took 2 pumps of it, basically 2 milligrams, and he started smiling appropriately. His voice deepened. Typically, there's an octave drop in the voice. He started talking faster. And this is a Marine that was on a SEAL team that had a trauma, and he had a great deal of anxiety and difficulty. And he took his usual position in the corner of the room, facing outwards, so that he was well aware and that hypervigilance was active. With 1 dose of CBD, he mellowed, he relaxed, his voice changed, and he was talking deeper, and he was smiling. And so there was real laughter that came from it. And that's one of the hallmarks of an adequate dose of CBD, is a natural
relaxation. Yeah, you've touched on a few best practices so far. One is to make sure it's 1 to 2 hours before bed. The second is finding an appropriate dose, perhaps starting at 5 or 10 or 15 milligrams. And if you're not seeing an effect, quickly moving up in dosage. You also mentioned holding it under the tongue for a certain period of time. So those are some of any other recommendations on first introducing this and making sure you're doing it properly, first and foremost? So those are a few best practices. Any others that you run into that people?
Well, a lot of people will be inclined to get capsules. And if you get a capsule, that's fine, except that when you take a capsule, it goes into the stomach and it goes through a liver metabolism before it gets into the bloodstream, which may not be as effective for you. But everybody's different. I would say, a capsule may be perfectly fine, and it's not the only practical way for you to take it. But if you're not sure you're getting the full effect, bite the capsule and swish it in your mouth, because CBD has an extraordinary ability to be absorbed by the mucous membrane and the skin as well. So you can use it on the skin. Dave, if you've gone to my YouTube, you've seen Teresa, who was an Alzheimer's patient in Canada. And I used the CBD on her, and I reversed her Alzheimer's disease in less than 4 weeks.
Cool.
Topical use only.
Okay.
So it's very, very well penetrated.
Eric is another individual who has some insomnia-related issues. He has to use multiple prescription drugs to sleep on a nightly basis. He had asked how he might start experimenting with this for an insomnia-based use case. What would you recommend in that specific application?
Well, I think I would use about 30 milligrams in the evening, probably supper time or a little bit later. Definitely not after 9 p.m.
Okay.
And assuming that he's going to sleep at 11, 10
Sure.
or 11, something like that.
Yep.
And then see if it's going to benefit him. I haven't had great success with primary sleep disorders.
Okay.
So when people have really difficult sleep problems, CBD hasn't been quite enough. But there's an interesting feature with CBD that taking it, you may not realize that you have slept. So
Yep.
it's really important that you have those devices for monitoring, because that will give you the true indication.
The hard data.
Exactly.
Yep, that's great. Okay, that's helpful. And then Denise had asked, she is dealing with autoimmune condition, ulcerative colitis, and she was wondering if this is something she should consider for her condition.
Absolutely. There's really excellent information about the effects of cannabidiol on ulcerative colitis, and in fact, all of the inflammatory bowel disease and the irritable bowel disease.
Well,
Now,
especially if it's all in the, if so much of this system is in the gut, as you mentioned, that it seems logical that if there are going to be benefits, that the digestive related and gut related autoimmune diseases stand to benefit particularly well.
Well, as well as the cramping. There's a great deal of cramping with these disorders,
Yep.
and CBD will stop that cramping.
Yep.
And it will stop the inflammation in the gut.
Yep.
And you're going to get a correction for a lot of these problems very quickly.
Yep.
So there's a number of particular benefits going to reduce the contractions and the hyper irritability, as well as the pain. Now, a lot of people with irritable bowel as well as inflammatory bowel are extremely sensitive in their gut, so that they have many more receptors than are in regular people.
Yep.
And if you can calm those down, you can reduce a great deal of pain, and you can calm down a lot of that inflammation. Now, specifically, cannabidiol has been very effective at working on those cytokines that are involved in the inflammatory bowel disease. Things like tumor necrosis factor. In fact, that's one of the major biologic therapies that people receive, is anti-tumor necrosis factor or receptor type of agents. Very expensive, on the order of $4,000 a month in order to get those kinds of treatment. And cannabidiol can do at least as well, and if in better, without any side effects or immune deficiency type of problems that can come from those agents.
Cool, thank you. And then a couple more here, Dr. Blair. This is from
just
Gina.
Let me say about the dosage on that. You're
Yes,
really
please.
looking at 60 to 90 milligrams.
To
Use
start.
as much as needed to control the symptoms right away, and then back off to a maintenance dose as you progress.
Start 60 to 90 and then back off from there.
Yeah.
Okay. So Gina was reporting that she'd tried CBD oil in the past with nocturnal seizure disorder. And she said, well, it helped with sleep and possibly some relaxation. Subsequently, there was instances of depression, anxiety, and panic attacks. She tried it again a year later with no depression, but anxiety occurred. So again, we don't know what product was used in this case. There's different qualities. There may also, we're not even sure it was 100% CBD. There may have been mixtures of THC in there, and that may have caused it. But what comes up for you with that comment? Is there anything you recommend?
I've never seen depression or reactive depression occur with cannabidiol, with the Elixinol product.
Yep.
I've never seen that sort of thing happen. And there is no rebound. There is no withdrawal.
Yep.
There is no potentiation in that way. So that's very unusual situation. Now, on the other hand, there are some people extremely sensitive, about 1 in 100, that if they take too much cannabidiol, they'll actually get an anxiety and an agitation. Most people get a relaxation and tremendous relief from anxiety.
Got it.
1 in a rare individual will, if they take too much, get a little bit antsy and not be at their optimum. That's easy enough. Just drop down the dosing.
Great. Okay. Very helpful. So just one last question, Dr. Blair, and you're working with a lot of individuals dealing with PTSD, and Are you seeing a lot of work around other remedies related to things like psilocybin or MDMA or other modalities? Are you seeing these on the horizons? I know that's not specifically related to your work, but are you starting to see that come up more in some of the clinical research or around some of the alternative therapies that are coming out?
Well, I'm seeing all range of alternative therapies that are being
Yep.
done, not those in particular.
Yep.
Of course, the strong movement for medical marijuana for types. There's a lot of different therapy approaches that people are using, trying
Yep.
to figure out what to do, and behavioral therapy as
Yes.
well as counseling, and loads and loads of drugs. A lot of these people don't respond with, but with PTSD, it's such a superb response with full spectrum cannabidiol. I have been amazed that people go into remission and they have a resolution of their PTSD.
Yep.
So the problem, they don't have to maintain a high dose, and they can continue at a much lower dose.
So, Dr. Blair, last question here. If someone wants to get started, and I went to your website last night, there's a range of products on there. If we were just looking for one for an individual to get started, there were the liposomal, it looked like there were some tablets, there were different products on there. Break it down to the simplest starting point for the person who wants to introduce this modality and start doing some of their own N=1 experimentation. Where would they go on your website, and where should we start?
I think the best product to start with is probably the liposomes.
Okay.
And that's a hemp extract liposomes. And the reason is because it's palatable, and it's got a great bioavailability, it's water soluble. So you can mix it into other substances, and it's very receptive by other members of the family. It can also be used topically. And now, once again, you just have to find the right dose. The price point on it is pretty reasonable at about $59. So that's very, very good. Now, if you want to get the lowest price area and still get some benefit and sort of buy your trial, then the tincture 300 is a great way to go, because it may not last you very long, but you'll find out what is the right dose for you. Now, some people do really well with the tinctures, and some people do well with the liposomes. You got to find out which one works best for you. But the liposomes, the jar of the liposomes can last you a full month. So it's a great place to start. And the standard dose of 5 pumps, which is 5 milligrams twice a day, is terrific. Now, if you find out that you need to have so much of the tincture, like 90 milligrams, you're taking care of cancer, then you want the big bottle of the tincture.
So 5 pumps is 5 milligrams, just for people who are trying to correlate back to some of the examples you gave of different starting places, depending on the condition.
Say that again?
5 pumps correlates to 5 milligrams.
That's exactly right.
Got it.
So, and on the other side, you're looking for the premier product that Elixinol offers is actually what's called an X-Pen. It's a concentrate.
I saw that.
It's very, very effective, and it has a number of other cannabinoids mixed in with it that give it an extra boost and an effectiveness. And I'm not talking about psychoactive. I'm really talking about anti-inflammatory character that goes on.
Well, this has been incredible. I think this information will benefit a huge number of people.
One more.
Yes.
There's one more. There is a product called Respira that can be actually incorporated as a vaporizer. And so using it in an e-cigarette type fashion, you can get delivery of CBD to the brain in a matter of seconds using it as a vaporizer. It only contains vegetable glycerin and CBD. It does not contain any propylene glycol, which has been concerning. There's been some concerns about that. Very effective, a very low cost. So it's a great all-around benefit, and I recommend it as a sort of a complement to a total CBD therapy.
Yes, well, I know that I'm already excited about starting to incorporate this into my routine. I take a number of liposomal products, so I'll probably start with the liposomal product myself. And I think that this information will benefit a number of people. As I mentioned, we've got individuals who are very invested in monitoring and tracking their health. They're always looking for new interventions that they can try on their own. You've provided us with some incredible information. We are extremely grateful for your time, and thank you for being here today.
Well, Dave, thank you for having me. I'm going to talk about my favorite subjects and how to transform people's lives through cannabidiol and these other measures and a ketogenic diet.
That's wonderful. Thank you, Dr. Blair.
So after the show, I ordered some of the products and have been testing them, and then wanted to share my experience with you here. So I tested 2 products. The first is just a straight CBD oil that is dispensed in a tincture. So it's just 1 tincture of CBD oil, and I was testing it either under the tongue or in a drop of water. Either one will work. So that was the first product I tested. 1 tincture is about 5 milligrams of CBD oil. And in the podcast, Dr. Blair talks about some recommended dosage guidelines. For a beginner, you can start with 15 milligrams. On the other side of the spectrum, he works with cancer patients that may be taking up to 90 milligrams per day. So if you're a beginner and you want to get started, I'd recommend starting with a dose of 5 milligrams, which would be about 1 tincture. So this was the first one I tested, which is just the pure CBD oil. The other product I tested was the liposomal CBD oil, which means the CBD oil is wrapped in a liposomal delivery molecule. What that means basically is that it's much easier for the body to absorb the CBD oil. So this one is served a little bit differently. This one is 5 pumps, which equates to 1 serving. And you can either take 5 pumps in a glass of water. I just take 5 pumps under the tongue. So that was my starting dose. Immediately what I noticed, and this is something Dr. Blair mentioned, but immediate uplift in mood. As soon as I take my 5 milligrams, I immediately found myself just in a much happier, upbeat, more energetic state. I would also take it before heavy workouts. So when I go to the gym, right before, say 10 minutes, I'd put 5 milligrams under the tongue. And then I also tested it before bed. Dr. Blair recommends about 60 to 90 minutes before bed is the optimal time to try it. So I was experimenting with 5 milligrams, which I noticed a nice subtle effect. Taking it up to 10 milligrams per serving definitely was more noticeable. And then you can titrate it up based on your own body, based on your own tolerance, and based on your own health goals. So these are the first 2 products I tested. If you're looking to get started and you just want to try out CBD oils, you're not really sure where to start, you don't want to spend a ton of cash, this is probably the best one to start with. And this is the liposomal product. We will provide a link below that will get you 10% off your first order. This is the smallest bottle. So I would start with this one. It's not a big upfront expense. It's just an easy, low-cost way to try out the product. So I think there's about 2 different flavors. Start with this one. Just order a small bottle. Start with a single dose, 5 milligrams. I was doing that 3 times a day. And then start to up it until you find the dose that's exactly right for you. We've been testing the Elixinol product for a couple weeks. We love it.